What's up, guys? Welcome to Precision Chiropractic. I'm Dr. Matt Westheimer, and today we are going to talk about degeneration. This is a big topic that has a lot of confusion out there about exactly what is degeneration, where does it come from, and is there anything that we can do about it? I'm going to talk about all of those today. I want to share a funny story with you, though, from years ago. I had a patient that came in, and she was an ER physician, brilliant lady, saving lives every single day in the hospital. And she was suffering from some spinal issues. So she came in to see me, and we were talking about degeneration. And I said, you know what's interesting? I said, a lot of patients come in, and when I bring up degeneration, they tell me that where it comes from is what their doctors told them is it's from just aging. It's a normal part of aging. She's like, yeah, that's pretty much what we tell them. And I said, well, let me ask you a question. I said, if you have someone that's 55 years old and they have degeneration in one of their knees, but their other knee, they have no degeneration at all. Have you ever seen that before? She said, yeah, of course, all the time. And I said, if it's just a normal part of aging and it's the same age, why is one knee degenerated and the other one isn't? And it was one of the longest pauses I ever had in the office. And she just kind of looked up, kind of thinking, and she said, I never thought of it like that. So it's amazing in healthcare, so many people are taught that degeneration is just a normal part of aging. But what we find is that there's some real key characteristics that cause your body to degenerate faster than it should. And the main reason of where that comes from is abnormal wear and tear. Think of it like this. Imagine you're driving your car, you have 4 brand new tires on it. I had a hole in my tire, so I had to get 4 new tires recently. And so imagine if I went back to the mechanic, after 7,500 miles, and I was looking at getting my tires rotated, and they looked at it and they said, hey, one of your tires is wearing out a lot faster than the other 4. So what are you going to think? Are you going to think that you just got a bad tire, or that there was something wrong that was causing that tire to wear out unevenly because it was the same as the rest of them? The answer is obvious, right? So you would look at, okay, it was probably something with the alignment. It was abnormal wear and tear that caused it to break down faster than it should. And it's the same way with the body. We should not degenerate, especially at the ages that we're seeing. Now, here's a caveat. If you're 75 years old and you have some baseline wear and tear degeneration that's pretty consistent throughout the body, you have a little bit of osteoporosis, okay, that's normal. As you get older, as a whole, our body starts to break down a little bit. But when you're 40 years old, 32, 53, and we see severe degeneration in, say, one aspect of the neck, but the rest of the neck or the rest of the spine looks completely fine, that's not a normal part of aging. Your entire spine is exactly the same age. We should have pretty consistent wear and tear throughout as long as we maintain and keep healthy alignment. So I want to talk about how this breakdown occurs and why it's so important to keep it healthy. If we look at the spine is made up of 24 movable bones. In between each of those bones is a piece of soft tissue called cartilage or a disc. And it's made up of 2 different types of material. The outer part of the disc is made up of what's known as an annulus fibrosus, which is a harder outer casing. And what's super fascinating about the outer casing is it's not just like one solid outer casing. It's these concentric rings that are each laid down at 30 to 60 degrees on top of each other like this, which creates incredible stability. It's kind of like a rope. You would never make a rope out of one strand. You have tons of strands interwoven, which makes it exponentially stronger than if it was one strand. And if one strand breaks, you still have the rest of the strands to hold everything together. So that's the power of that. Now, with the disc, all those concentric rings hold together the inside, which is what's known as the nucleus pulposus. And that's a softer, more gelatinous type of material in between there. And what that does is it acts as almost like a pivot point that allows the spine to move and bend, and it also creates an opening for the nerves to come out. And that gap is incredibly important. So I apologize if you hear dogs barking in the background. We have some entertainment here and an audience while we're speaking. So you have the discs that separate these bones and create space for the nerve to come out. Now, as long as you have normal alignment, then that creates a pumping action. It's what's known as a process called imbibition. So it creates a pumping action for that disc that flushes fluid in and out of that disc, almost like a sponge, where you squeeze a sponge and let it go and it draws back in water, and then you'll squeeze out the dirty water and draw back in the clean water. That's the imbibition. That's the pumping action of the disc. But if you have an abnormal shift in your spine where one of those bones shifts out of position and it's locked out of position, now that's not moving the way that it should. So that disc isn't getting that imbibition or that pumping motion. Over time, that causes that disc to wear out. Those concentric rings start to wear out, and that's when you can lead to either a disc herniation or a disc bulge, or also then you start to see the bones lay down more bone, and that's where we start to see bone spurs, which is a process known as Wolff's Law, where whenever there's stress to an area of bone, it will lay down more bone in order to protect and stabilize the area in the response to that increased stress of that area. So as you can see, it's a really, really big picture that we're looking at. But those are the basics of where degeneration is coming from. So if you want your spine to be healthy, if you want your discs to be healthy, if you want your joints to be healthy, you have to make sure that you have, number one, normal alignment, number two, normal movement, and then number three, normal stimulation. And when you combine those three things, that's where not only do your spine and your joints actually rebuild themselves, but we're able to keep them healthy throughout our entire lives. So I want to thank you so much for tuning in today. And until next time, keep your body moving.